Hi, I'm Adam Kramer, and I'm with the National Park Service's Office of Public Health, and I must have just hit the wrong button altogether. Nothing like, you gotta love technology. When it works, it's great. When it doesn't, you run with it. So I'm with the National Park Service's Office of Public Health, and one of the questions may go, well, what's the National Park Service doing here? And really, one of the things to keep in mind is we're a land management and conservation agency, so why would we be here for help? Well, you gotta realize we have 405 national park units. We see 277 million visitors a year. And with this, we're gonna show a little bit of how some of our data can be brought into it, and thinking when you're looking at data to think broader, not just with what HHS brings, but with what some of the other federal agencies bring. Jennifer mentioned the Census Bureau. They bring a lot of data. It's commonly used, but we do have a lot of other data sets that may be out there. So within the Park Service, we have an Office of Public Health, and with that we basically serve as the internal health department for the Park Service. So we do a lot of environmental health, assessing food safety at restaurants, looking at water, wastewater systems, but we also have a health promotion branch, and that's what we're going to talk a little bit about here. So with it, I do want to talk about what are some of the data sets that are there. Data.gov got mentioned. For the Park Service, we have over 1,400 data sets that are on data.gov, primarily boundary maps. We also do have vegetation data, hydrographic records, as well as even getting into Civil War records. We do have water quality, which gets shared with EPA's STORIT database. And then one of the internal ones we have is the NPS, the IRMA data portal. It's an integrated resource management application. And there we have information such as visitor use statistics, park species lists, if you're ever wondering what animal is there, water quality data, as well as some biological monitoring protocols. One of the other ones is recreation.gov, which will give you access to information on activities that are available through publicly funded lands across the country. And with it, one of the applications that really got developed with our data is the DC Park Prescription Program. And what they did is they took a lot of our boundary files, and then they did assessments of the individual park boundaries and what were the parks, what were the facilities that were there, safety, everything else. And working with one of the local medical providers here, they actually integrated it into their electronic health record system. So now when they have people coming in, they're looking at prescribing nature, giving their patients this information on where can they go to take a walk, what are the activities that are there, so people can get out, get a little bit of exercise. As they found, about 1 in 3 chronic diseases are going to be driven by lifestyle. So if we can adjust that lifestyle, getting people exercising outside, we have that ability to affect those chronic diseases. So with their short-term, they're looking to do this. Long-term, they're looking to see what is the effect of prescribing nature. Is that really having an effect on people's health? I think logically we go, well, yeah, if people are exercising, it is going to be good. But again, this was done as a combination of those data layers that we had, but with a little bit of exercise. So it's one of those where we can combine our data with other sources to find something. So again, I would recommend, as you're thinking about this, what are some other data layers that are there that may be in non-traditional health agencies to think about. And we just kind of have a little bit of our contact information up here, but I look forward to answering any other questions as we move into the Q&A section.